And let's hear now from Dr. Brent Lipscomb here, also a physician partner at Lakeside. Doctor. Thank you. It's good to see you. Thank you.
Thank you, Congressman Brady. Over the last century, the advances in medicine have been unprecedented, from the development of antibiotics to defeat infection, imaging capabilities to study normal and disease physiologic states, as well as potential cures for disease on a microscopic or genomic level. Despite these changing medical advances over the last several years, the physician-patient relationship has not changed, nor should it. Each day in this country, thousands of patients will see their doctor, trusting that these physicians at best will improve their condition, and as importantly, will not worsen it. All of us in healthcare should respect that trust. As physicians, we spend time with our patients to listen to their problems, to develop and implement a treatment plan collaboratively, and this is what gives us our gratification. In order to develop this treatment plan, patients trust their physicians to lead them to hospitals which will provide them the best care. St. Luke's Lakeside Hospital began with a vision in February of 2007 as a group of board-certified physicians met with St. Luke's executives to develop a hospital which would provide unparalleled cardiac and orthopedic care in this growing community. We have built an outstanding facility, but more importantly, the trust which we have built collaboratively with St. Luke's has driven us to push each other to give our patients the best efficient care. The size and scope of this hospital will allow our nurses and healthcare personnel the freedom to individualize our patients' care with compassion and dignity. Our mission and responsibility is to earn our patients' trust each day as we go forward in this facility. I would like to thank Congressman Brady for the opportunity to discuss what is the cornerstone of healthcare. Thank you.
Thanks, Doctor. We also have a physician partner from Reliant Healthcare's effort as well, Dr. Travis Hurd. Doctor? Hey, Travis, nice to see you.
Good to see you again.
And thank you again for having me at the hospital.
Thank you. Good morning, everybody. I was asked to speak today a little bit about what I do and what our hospital can provide for the community. I actually grew up in the Woodlands, so I've seen a lot of change. I moved here in 1978 and used to ride my bicycle in this area when it was dirt paths. So everybody can see Montgomery County is changing at a rapid rate. Therefore, the population is growing, and that's when we have to provide the care for the people. We have to have the beds, and we have to have the space to take care of them. I've been practicing here about 6 years in primarily inpatient rehabilitation, and as it's been said by Abe and Emmett, the basics of inpatient rehab is to provide care, post-acute setting, for people who have had anything that caused debility. Spinal cord injury, stroke, brain injury, orthopedic procedures, orthopedic fractures, pulmonary issues, you name it. We can usually take care of them if they have a debility and they aren't able to go home. The normal process is that a person ends up in an acute care setting, they become stabilized. At that point, the physicians in the acute care setting, St. Luke's, Memorial Hermann, Conroe Regional, decide, hey, we've done what we need to do, and it's time to get this person closer to going home. What are our options? Well, our options are a long-term acute care hospital where they typically focus on a small amount of rehabilitation and long-term IV antibiotics, wound care. Another option is a rehab hospital such as ours, where we focus on 3 hours of therapy a day with the focus on improving a person's levels to get to hopefully a home setting. And we also manage medical issues that do arise, and that does happen, and or they can go to a skilled nursing facility where typically that's a longer length of stay, less rehab, and typically less likely to get to a home setting. So the doctors in an acute care setting say, we're ready for this person to go. They call us in, we go check out the patient. We do an evaluation, they call me, what do you think? What do you think, Travis? I go, well, I think we can do it. Let's bring him in. So we bring him in. When we start getting to know the patient, getting to know the family, figuring out what their deficits are, trying to avoid complications while they're under our care, and ultimately figuring out what it's going to take to get them home. And it's not easy. You know, you can think of all the different diagnoses and everything that can come up, all the way down to who's going to drive them home, okay? It takes a well-coordinated team to get this to happen. And right now we're running over 80% return to home, which is great. It's the best I've seen. I've been a part of other rehab facilities and other rehab settings, and we're doing a wonderful job. The staff and the hospital and administration is exceeding my expectations in every realm. I was approached by Reliant Rehab about 2.5 years ago. What do you think? How about being a part of a new rehab hospital with a physician joint venture? I'm like, absolutely. How many guys you want? And we started going out and talking to doctors in the community and realized, and I already knew there was a need, but what was reaffirmed the need for quality inpatient rehabilitation in this area. And we got it started 2.5 years ago. We were sitting down in boardrooms and slowly but surely got the funding, broke ground, built the hospital. January 2nd, I admitted the first patient. And, we actually kind of, we were worried. Shoot, we would have loved to open up at the end of last year, but the hurricane set us back 2 or 3 weeks. So we did what we had to do. We opened up, admitted our patients. Joint Commission came in. We did everything we needed to do and missed it by, 23 days. So far, so good. We have 40 beds open out of 60. We're not interested in opening too quickly and not providing the quality of care. We have 20 beds upstairs just waiting to be opened up, and we could probably fill them, but we want to have quality staff, well-trained, well-oriented, and to move forward and continue to provide that high standard of care. It's a pleasure to be working with this group in this project. Everything is going well. We're ready to take care of patients. It would be a shame if we were forced to close for something as arbitrary as a date. I mean, we're here, we have staff, we're ready to take care of your family and friends. Hopefully not, but if you need it, we can. And I just think that it's great that Congressman Brady is going to try and help us out.
Thanks,
Thank you.
Appreciate it very much. I didn't realize till I'd met Dr. Hurd that was Eric your little brother?
Older brother.
Older brother was an intern in our congressional office, worked on our staff. Now he's a successful attorney with kids. It's one of those, man, I'm getting old moments, you know what I mean? Look, let me close with this. Changing the rules in the middle of the game for physician-owned hospitals will shut down 40 hospitals in Texas, cost us nearly 15,000 jobs, and cut much-needed local top tax revenue. So how can you claim to be increasing access to medical care when you're shutting down medical care in fast-growing communities like ours and in fast-growing states like ours? The Democratic health care bill is being rushed through the House in the next 2 weeks. This is an urgent issue. The solution is for hospitals under construction or awaiting their Medicare provider number to be allowed to complete, and the prohibition, if it's needed at all, to apply to new hospitals once the legislation becomes law. That's just common sense. That's what we're going to fight for. That's why we're having this meeting today. And it also raises the question, if the government can't make common sense decisions on healthcare issues like this, what kind of decisions will they make when they're controlling your healthcare or your loved one's healthcare? And I'll finish with this. The only reason this is an issue is that there are some in Washington who want to pit traditional community hospitals against physician-owned hospitals. I think that's a false choice. I think if you want to increase more choices for patients, foster innovation, create new way of bringing care to your community, we ought to be encouraging both traditional community hospitals and physician-owned hospitals. And two of the ways we could do that is to, one, for the government to start fairly reimbursing hospitals for the emergency room care and the unreimbursed care that they drag around on their balance sheet, and that makes it so tough for hospitals to survive and prosper these days. And secondly, rather than putting up walls between hospitals and physicians, we ought to be tearing them down. We ought to be encouraging health care providers to align themselves together all toward the patient. That's the answer. This is a bad provision. It snuck in a huge bill that I'll tell you, the House Ways and Means Committee took this bill up last Thursday morning at 9 o'clock. We got the bill, all 1,018 pages of it, at midnight the night before. and started to vote on it at 9 the next day. We asked some pretty basic questions. The first one was, how much does this health care bill cost? And they still can't give us a price tag on it. That's not good legislating, and when you're dealing with people's lives, when you're dealing with their health care, that's no way to run any kind of business. So with that, why don't I stop? Tracy, can we take some questions from the press first and then the audience? Any comments from there? Would that work okay? For gang?
They want to do a one-on-one, okay?
You okay with that? Great. Any thoughts before we end up? I want to thank everyone for being here today. This really is a critical issue for our community. And again, it's not a matter of picking a deadline. They picked a retroactive past deadline, which no one can control. It hurts people who played by the rules, followed the law, did everything right. That's wrong. So that's what we're going to move to stop up in Washington. We're going to need vocal help to do that. So thank you, all of you, for being here today.